University Dawn.
Only audit institutions, effective budget tracking, e-government, e-procurement, and curbing illicit financial flow, they are the only practical ways of fighting corruption. So,
all on your public broadcaster, UBC, inspiring Uganda.
No form of identification has been specified by URA as mandatory for issuance of an e-invoice or e-receipt. In case of a sale to a final consumer, the buyer is required to provide any of the following: name, contact, taxpayer identification number, TIN, or national identification number.
Uganda Revenue Authority, developing Uganda together.
Welcome to English in a Minute. Speed is how fast something moves. Maybe this expression has something to do with car racing. Jonathan, did you get a dog?
No, I'm just watching Ashley's dog this weekend, so I'm getting up to speed on basic dog care.
Oh dear.
What?
Look, her dog can be a little, unusual.
It is intellectually engaging.
Court does not sit to waste its time. If you have no defense, it chases you.
It is a ruling on the foundations. Business has been conducted in a certain way.
Banks take money from us, depositors. All of us seated here have got money in the bank. And even before you walk out, they've given that money to somebody else.
Deeply incisive.
The law enjoins us to be answerable to the sovereign of the country.
Members of the force, we have always been demanding officers to be highly disciplined and being accountable to people of Uganda.
Authentically symbolic and insightful.
We should work so hard to evacuate this power.
Behind the Headlines, every Wednesday at 10 p.m. with Charles Odongto.
Very welcome.
Probably the most experienced talk show moderator in Uganda, with a team of illustrious panelists. Honorable Margaret Mohanga, a veteran journalist, legislator, entrepreneur and development consultant, and Ramadan Gobi, an economist and university don.
I've really got perturbed that in Uganda we are building parties with no membership subscription.
All on your public broadcaster, UBC, inspiring Uganda.
Good evening and welcome to this edition of UBC Behind the Headlines. My name is Tony Kent KYAZZE, and it's a humble welcome that I do pass on to you, our dear viewer, today. This time round, we are talking about the biggest of issues when it comes to the talk time, the corridor talk, the gossip, executive, cabinet, and probably as well Parliament. What are we talking about? COVID-19. It's back, and it's back with a bang. On this particular edition, the 48th edition, we're going to be looking at how exactly this particular wave is affecting us as a country, Uganda, look at the health sector and perhaps the capacity to handle this particular situation, and so many other entities therein. Remember, you and I are failing upon so many things, while it's at the same time you and I are probably doing what we think is the right thing. With me in studio, perhaps people that do not need prayer introduction, but I will give it unto us. But probably let's start off with Honorable Dr. Joyce Moriku Kaduchu. She's a pediatrician and as well the woman member of parliament for Moyo District. She's here on the show to give us a bit of an insight concerning this that we are talking about today. Welcome to the show, Honorable.
Thank you. Good evening, viewers.
And well, to her right is one of the usual suspects, that is soon to be Honorable Sarah Birete, Executive Director at the Center for Constitutional Governance. Welcome to the show, Sarah.
Thank you, and good evening, viewers.
Wonderful. Then, of course, next to Sarah, on her right, is another one that is big in as far as the capacities of hierarchy in the country are concerned. That is Honorable Dr. Thaddeus Nicholas Kamara. He's actually the Member of Parliament for Kabale Municipality. Agandi, Honorable.
Good evening, viewers, and I'm happy to be here in UBC studios for the very first time.
Wow,
Thank
that's
you.
wonderful to hear. Then, of course, to his right is someone that enjoyed powers of a minister for quite a while and probably expressed it on air. Not for so long, though, was this kind of situation. Mr. or rather Dr. or Professori Ramadan Gobi. He's a policy analyst, an economist, and as well, a minister for a while he was, a couple of weeks ago. You're welcome to the show, Ramadan.
Thank you, Kent, and good evening to the panelists, the honorable members, and my usual, people we sit here for the week. They were expecting something else, but that's how I will introduce them. I always enjoy the viewers. Thank you.
Quite interesting. By the way, if you're wondering about his security, he has good security. So yes, indeed, he could be a minister in the making. After all, there's one slot left. And perhaps as well, for those of you that have been pointing fingers, when it came to the debate on whether or not to have an extra slot for a minister, put into consideration, one of those that stood and said, do we need this kind of argument on whether to have an extra, or the argument should be whether or not such ministers are necessary? Well, who is it? None other than Honorable Abdu Katuntu. He had actually promised not to return, not on the show, but rather where he comes from, but eventually got back and is now ready to serve his people for the next 5 years. Welcome to the show.
Thanks very much, Kent, and good evening, viewers and my colleagues, plus our guests this week.
Wonderful. Honorable Katuntu, maybe before we go to the majors, that is the doctors on the show, to give a bit of a highlight concerning the situation as is, more so on this 48th edition of UBC Behind the Headlines. Your constituency, is it still a whole constituency or it has been split?
Well, my constituency has always been Bugweri County, but since 1.5 years ago, it became a district. And as I've always joked, we did not have a woman representative for a long time, so I was the acting district woman P.
Yes, yes.
Of Bugweri district for a long time.
Yes.
I have since then handed over to my colleague, the Honorable Rachel Magola. But it was good as long as it lasted.
How did it feel being a woman? Not a woman representative, but being a woman.
How did it feel being an acting woman representative? You have to describe me properly.
Definitely.
It was great. It was great. I enjoyed every bits of it.
Okay.
But now I am the district money representative of Bugweri district because my constituency is actually a district.
Okay. Thank you so much, Honorable. Gentlemen and ladies, we all know the situation as is currently. So many prescriptions are on the market and probably self-prescriptions. I actually saw there is a seriousness within us, within and amongst us. Everyone that there is on this platform is probably having a small bottle that has something in it, and that is probably sanitizer. We are getting serious to that level. Yes, the public is as well having people that are that serious. But the surprising bit is there is so much of self-medication and self-prescriptions. Concoctions are on a rise. We are all becoming experts, and everyone can actually give you guidance in as far as treating COVID-19 is concerned. There's as well the interesting bit of the price of treatment, which perhaps the papers have tackled today. That is the newspapers. It's quite so exorbitant, so hurting perhaps. And maybe people are wondering, do we have a monopoly over this? Or perhaps you need to be looking out for the best treatment in as far as the cheapest you can have availed to you. The rate of infections is high. Death this time round recorded, not as was the case in the very first wave, that is early last year. Dr. Joyce Moriku, as a doctor, the situation at hand, what has gone wrong? And perhaps what can we put right?
Thank you so much. I just want to once again take this opportunity, first of all, to thank you for inviting me for this very important discussion. And I really want also to take this opportunity probably for us to appreciate the current situation. Let's take our minds back what happened last year. Recall last year in March 11th, when World Health Organization declared this virus as a pandemic. And for that matter, it called all member states to put in place measures to prevent, manage, and mitigate this problem. And indeed, our country, our government, the head of state, responded promptly. Following that declaration, on the 18th of March last year, that is when the head of state put in place the 35 strategic directives. You recall the airport, the schools, the churches, and all those came to a standstill. And from that time, before even we got our first case on 21st of March last year, and from that time, honestly, the people of Uganda, I must appreciate them, I must give them I must salute the people of Uganda, because given that time, the interventions, that what people did, that really rank Uganda globally among the best countries that has suppressed the viral transmission by the end of August 2020. Recall, Uganda was among the best in Africa and 10th globally, and it is because of the measures we put in place. And by that time, we had not reached stage 4 according to WHO classification, because at the beginning, stage 1 was basically preventing the entry of the virus into the country. We did everything possible to stop the virus importation. But as soon as the virus were imported by the people who jetted into the country through the airport, the border points, and what have you, we tried as much as possible to put other measures as a country, but all the same, infections went into the community, sporadic infection among contact cases, it then went into clusters, and finally, by the end of August last year, we ended into stage 4, extensive community transmission. That was when the virus was all over the community. You cannot trace it. After that, recall from the month of October up to December, that was the time when we had a really peak of the virus. And in December, at one point in time, we reached per day, it was 1,200, above 1,200. That was the highest case we registered in that period. And after, when we went to the scientific campaigns and election period, the projection by scientists was that the worst scenario was yet to be seen. But God was with us as Ugandans. From January up to March, we saw significant reduction. However, that coincided with the environmental weather. And that was the time when we had a lot of sunshine. The rain season reduces in December. So after March, we started another peak from April. It went to May. Now we are in June. And at one point in time, the highest number we registered went up to above 1,500, up to 1,700. Now, having this background in our mind, the question that we want to ask ourselves is that this first wave, why is it different from the second? Why is the second wave different from the first wave? The characteristics are significantly different. First of all, the spread is so fast, like a bushfire. Number two, the progression to severity, to critical stage is very fast. Number 3, the presentation is not typical as the first wave. The first wave, you see people coming with the flu, cough, fever, headache, progressing difficulty in breathing, mileage, and what have you. But this time round, you get sometimes people have lost their senses. They may not be able to taste, they may not smell, they may have just body weakness, yet they are already incubating the virus. Number 4, does not segregate. It had not spared any of our children. The previous wave, we saw more with the elderly, we saw more with the people with underlying medical morbidity, like those with cancer, HIV, hypertension, like blood pressure, diabetes, and all those medical conditions. But today, this present wave, it rather even target the school-going children, the younger age group.
Yes.
It is affecting mostly 20 to 39 age bracket. Now, why is it that different? Why is the first wave different from the second wave? That is the fundamental question that we want to ask and to understand. The reason why, well, first of all, we all know virus. Science tells us that virus replicate, meaning that in the process of multiplication, in the process of producing, there can be deletion. It may not come to the original form. It may produce different form. The genetic material may vary. That is why we've got the different variants. You hear about the Indian variant, the UK variant, the South African variant, the Nigeria, which is all here. And that actually worsened the situation. That is why the current wave is rather more aggressive, because the original virus that we know from China is no longer the only variant that is in the country. We also have other variants. The second reason probably we can attribute this to is the environmental factors. Recall, all this peak comes at the peak when there is a heavy rainfall. In Uganda, ordinarily, rainfall comes between March, the first comes between March and June, then another season comes between October, November up to December, but it varies because of these days, the environmental factors. But previous studies which were done with other types of virus, like influenza virus and other flu virus, they demonstrated in Uganda the peak of this virus is normally during heavy rainfall. And also, this virus that scientists have studied, coronavirus, when you have a temperature 65 degrees and above, it really destroys the virus. When subjected, within 3 to 5 minutes, it destroys. And temperature much higher, it destroys it even faster. Meaning that when the temperature is a little bit higher, the survival chances for the virus is minimum. But when the humidity is high and the temperature is low, then the virus takes longer time to die. Meaning during heavy rain, during cold weather, the virus survives longer. But also, when there is a lot of shine, people get vitamin D early in the morning, in the evening, and vitamin D is immune modulator. Absolutely. It helps to strengthen our immunity. So that explains why these environmental factors has contributed to this, the worsening of this wave. And then lastly, the human behavior. Our human behavior. You know, we are social beings. The humanity. Recall when the virus, when the infection rate came down from October, November, December, by January, we forgot all what it takes to prevent this virus. The social distancing, hand hygiene, face masks, the gathering, people were celebrating as if there is no virus at all. Yet the virus was in the circulation. We were getting to the parties, the funerals, people gather in huge numbers, the churches were operating normally, the taxis and all that. So that alone actually has contributed significantly, yet again, for this heavy infection rate we're seeing. That means that the virus was in the circulation, and then it was just waiting for a time that it really went up.
Doctor,
Yes.
let's probably put a pause at you at that particular point. Let me shift to Dr. Kamara. There's been elements and probably observations made by Dr. Morichu. And as a doctor, let's put aside politics, honorable and the likes. As a doctor, do you feel this situation is containable? Because probably from what Honorable Joyce has actually made mention of, there are things that probably could come to normal if we actually styled up and changed. Is this situation containable?
Yeah, thank you, Ken. Once again, I want to thank my fellow people with me in the studio. I want to appreciate you, Honorable Katonto. And I've also seen Ramadan Govi. I think he's a former Minister of Finance on social media. and I'm happy to see you in person, and my friend. and of course I was at medical school with Honorable Moriku, and I was just 1 year ahead of her, and I want to appreciate your input and your submission. So what do we know? Just before I talk, I also want to, because I may forget, I want to send condolences to the people who have lost their loved ones. I want to especially appreciate the frontline workers, the people who have lost their loved ones. We lost a very young doctor on the front line, and unfortunately, and that's what I'm going to be talking about later, but unfortunately, this doctor could not afford the costs in hospital. It is very, very painful. So, having said that, as Dr. Moriko has said, this epidemic is not like the first wave. The second wave has come in a different way. So, I want to emphasize what is taking place on the ground and what we know.
Yes.
What we know now, as she has said, the infection, the death rates are higher than the first one. The positivity rate is higher. In the first wave, if you tested 1,100 people, you would probably get 5 who are positive. Now we are approaching 20. If you test 100 people who are with symptoms, you'll probably get 20 who are positive. That is quite high. The third thing is that, of course, it is stretching our health system. Today, as you said, you read in the papers, and you saw that in Kampala, in the private units, the ICU beds are all full. Every day I am on a forum of doctors, many fora of doctors and consultants, and every day there is an SOS call of a doctor looking for a free ICU bed in Kampala. Well, in Mulago, they are telling us the ICU beds are there, they are working, but I wonder why doctors are always looking for ICU beds.
Since you're a doctor, you could tell us why. Perhaps you have inside knowledge or info.
According to what the director is saying, he's saying that the beds are there. But I will need to find out where these beds are actually there. So I haven't got that information.
But there's also the whole bit of difference between high dependence beds, ICU beds, then standard beds. Maybe we are mixing it up somewhere somehow.
No, of course, if it was supposed to be mixed up, I wouldn't be the person mixing it up.
Definitely.
I wouldn't be the person mixing it up.
Yes.
I've been talking to Honorable Abdul Katunta, and I told him that the only time I've walked out of ward and I was still in ward was only 2 years when I was a medical superintendent of Nyashibari Hospital in Rukunji. Otherwise, I'm a ward man through and through.
Wow.
So, the other thing we are hearing, because of the numbers and of the numbers which are coming fast, is the oxygen, lack of oxygen in hospitals.
Which has become a big business for those that are dealing in it.
Yeah, it has become a big business, but at the same time it is not enough. Even if they produce, it's not enough. We were told by the permanent secretary recently that even what is produced is not enough.
Because now oxygen is like cooking gas.
Cooking gas.
People are making flyers and posters on social media, home delivery, office delivery, and you wonder what's happening.
So another thing is the stretch of health workers. Today again there was an SOS by one of the directors of a regional referral hospital saying that he's calling up doctors, I don't know whether they have called nurses, to go to hospitals to save the situation. In Kabale Hospital, which is in Kabale municipality, I have asked today, and the CTU, Corona Treatment Unit, has only 2 doctors with over 60 patients. These people are supposed to work day and night, and there is a lot of stretch on the health workers. Unfortunately, Dr. Moliku may have to clarify this, but some of them have not been paid. Even their allowances for the first wave. And when they called us today, they said, one of the doctors were saying, now you are calling us to volunteer, but what is your plan and what is your budget? Even if you are volunteers, you need to eat. You need to eat, you need to bathe, you need transport. There is also a cost implication on that. So another thing that is coming up is home-based care. These people who are at home, they are many, because in Kabale Hospital, again, Kabale, I'm told there are over 400.
Simple terms, Kabale is the case study for your submission.
For me,
yes.
Because for me, I'm a representative of the people of Kabale.
Which is okay, Honorable. Yes.
Yeah, but I also know other places have home-based care patients. So these people have been left on their own, almost.
Who is supposed to take care of them?
It is a breakdown, basically, of primary health care.
Which
what we should have done now, probably, if the village health teams were very active, they would be involved, because we don't have enough health workers at present to follow up on all the people at home.
So, Doctor, just wait just a moment. Do you feel perhaps if such entities were in the right kind of order that perhaps you project, COVID-19 wouldn't have stretched us this much in the health fraternity?
That is another question, but I'm just let me finish just conclude the challenges that are on the ground. Then I can
please
conclude. So home-based care, patients are at home, self-medicating, giving themselves all sorts of herbs, without any follow-up of health workers. In any case, the health workers in hospital are already stretched. There are no health workers who should follow them. Of course, there should also be a surveillance team. But as I hear, the surveillance team has not also been facilitated to go and at least do some basic monitoring of people at home. These are the problems we have. When it comes to drugs, the drugs for people who are admitted in hospital are there. But for the people who are outpatients and they are being sent, most of them do not have drugs. Now it comes to the problem of our pharmacies. There is no regulation at all. You go to a pharmacy. Recently I got a prescription from my doctor. I went, I took it there, because much as I'm a doctor, I don't prescribe for myself. But when I reached pharmacy, these people were just coming and saying, oh, I want zinc, I want azithromycin, I want dexamethasone. As a person, my background, by the way, is in diabetes. I'm a diabetologist. So imagine somebody ordering dexamethasone for a month on his own. I said, oh, I want dexamethasone, give me for a month. I want also azithromycin, give me for a week. Vitamin D, I think you will give me for 2 days. There is no regulation. Drugs are poisons. So we cannot let this be. Like people can just go to a pharmacy and order drugs on their own. Another thing that is happening, PPE, personal protective equipment. Actually, by the way, I read Chibuli was also complaining. A private hospital. How about government hospitals? So, having said all this, I think I want to commend the government. It is a little bit more prepared this time. Because in my health center in Kabar again, because you said I don't mention Kabar.
No, come on, doctor.
In all the health center fours, at least there are tests for people who have symptoms. Yesterday they were out of stock, but they have tried. Where they failed to prepare for a whole year was oxygen supply. I think they slept a bit. Government slept a bit, system slept a bit, prepare for oxygen. So the third thing they didn't do well is preparation of beds. So what I propose now, what I would propose is that for oxygen they should get manufacturers very quickly.
Just like we improvised for sanitizer.
For sanitizer, manufacturers very quickly. For financing, which is a center of medicine, when you talk about health workers, PPE is what? Financing is always in the center, others are just at the periphery.
Yes.
Finance everything, even volunteers need financing. What can we as members of parliament decide? What can government decide now? Can we cut the seminars this year? Can we cut the buying of cars until next year, next financial year? Can we say that there were supposed to be textbooks this year and now that they cannot be bought? That money can be sent to buy for COVID, for the war against COVID. There are so many things we can do. But ultimately, it is personal protection that will help us.
Personal responsibility.
Personal responsibility. And then vaccination. So governments should make sure that we have vaccination as soon as possible. All these things, even a third wave is coming. So I don't know, when it gives us a break, when it finally gives us a break, we must look for vaccines. We must have as many vaccinations as possible to make sure that
everyone is safe.
Everyone is safe.
Doctor, let's probably at that point transition to a fellow legislator in Honorable Katuntu. You talked about cutting of the budgets to see to it that more is pumped into the fight majorly against COVID-19, but of course vis-a-vis there's so many other diseases that disturb the population. And you talked about vaccination as well. So Honorable Katuntu, probably let's start with the cutting of the budget. You must have studied the 44.7 trillion budget, and surely there is a big chunk that goes to the health care system, that is the health ministry in particular. Do you feel we need to cut more of the expenditures to facilitate the health fraternity?
It's not about feeling. Do you have an option?
Wow.
First of all, when we were doing this budget, we did not envisage that there would be a second wave. We didn't. And we are planning like we are going to be faced with the challenge of the first wave. But like now Dr. Kaduchu says, Dr. Kaduchu and Dr. Kamara says, the first wave was an bachelor's party. The real thing is now here to come. On a lighter note, the first wave was China. And you know what China is. Now the UK virus has come. The Western world virus has come. So the joke around is the Chinese virus will end up being like any other Chinese product. Anyway, having said that, are we losing the war? this second wave really would require a lot of resources. There's no doubt about it. And we have to look again to our budget to see where the wastage is, which we have to cut, save, and try to address this problem. The first, according to these professionals and scientists, weapon we need to have is vaccination. That's the first. But then, much as we have the money, do we have the vaccine on the market to buy? Or can we now manufacture our own vaccine? I think there is a process, some scientists are trying to do it. To me, I look at that as long term. As of now, the crisis we have, even if we have the money, I don't think there is enough vaccine out there for us to buy. That not being the case, then what do we have to do next? One, to strengthen our immunities as individuals at a personal level. And then the third one is to do the standard operating procedures, which Dr. Kaduch has been trying to tell the public. Once we finish that, then we have to pray. These Ramadans, you should know.
Prayer is paramount.
Go for the 5 times prayer every day.
They
to ask God to
turn
help
it
us.
to probably times
because
2.
you see, once there is no vaccine, we've gone through the immune system, SOPs, what is left? Prayer.
So, Honorable.
So, the most important thing is now we need the money, yes, but we need the money for what? Do we need money to buy the vaccine? But is there a vaccine even if we had the money to buy? 2, do we need money for purposes of boosting our immunity? There are these concoctions. You know, we have no choice. You know, Dr. Kamara is saying, you know, self-medication. You see, that one you can tell to people who are not as desperate. If you are now desperate and you've been trying to hear Dr. Kaduch saying, you know, if you are to boost your immunity, you need a lot of vitamin D. Every morning you don't need a prescription. You go out there and prescribe yourself because she has told us, she's a doctor. Then from there you need zinc. You don't now need to go, doctor, do I need zinc or not? You will go there and where do I get this zinc? Is it there? Is it through food and so on? And you do that. So really, self-medication is going to be a reality in our lives.
It's a new normal, actually.
It's a new normal. And what the doctor should assist us is to go and really educate us on the sort of self-medication we should be asking. And then, you know, you can have it, but also the dosages, what quantities and so on. You have to go to radios, to television like this and so on, and educate the people about this.
And perhaps
because
as well, seek consent from
because
NDA,
the problem is one, you don't have enough medical workers. And people are in their homes. And as Dr. Kamara says, you don't have follow-up. People who are going to their homes to visit them and say, how are you, change the doors like this. You don't have that system now. So what do you do? But the crisis is so much. You just need to drive in this town or stay in this town and you hear ambulances moving around throughout the day, throughout the night, crisscrossing town and so on. The situation is really, really dire. And you need to tell our people, this thing about SOPs, it's no longer a joke, it's no longer fashionable. This thing of wearing your masks on your chin, you know, you go to a supermarket and there is a washing place and you are saying, no, me, I have already sanitized. Oh, that, because you can't say, I have over-sanitized. Is there an overdose in sanitizing, Dr. Kaduch? We should be sanitizing as much as possible and so on. Because we have no option. Otherwise, we are losing the war. Later on, I would think the president should come in, or the team, really to sort of... we've not gone to a lockdown.
The president promised to come back.
I think he should come back a little bit earlier than we were thinking.
The proposed time.
Yeah, because really the situation is getting out of hand in my view.
Sarah, The vaccinations have been ongoing, and I'm wondering whether you've taken yours or not. But why I've actually asked is because we wonder, as the general public, by the way, the vaccine that comes, or rather that is on the market right now, was initially meant for the virus that came from China. Surprisingly, we hear of a South African variant, a Nigerian variant, we hear of a Brazilian variant, etc. So, as you took that vaccination, what did you have in mind? Were you having in mind this vaccination will help me, even if the Brazilian variant comes my way, I'm safe? Or perhaps you just knew it, you were taking a general vaccination for COVID-19?
Well, as a non-medical person, I took a COVID-19 vaccine. The doctors might know the details, whether it works for certain variants and they do not work for the others. Really, that's not my area of specialization. But I want to talk about vaccination as an important mitigation strategy that we need in this country. I know there is talk of scarcity of vaccines. Today we got a consignment donated by France.
Over 170,000 doses.
Yes. I also know there are so many people in my category waiting for their second jabs. I hope that when that time comes, the second jabs will be available. If they are not, then do I lose the immunity of the first jab? Do I start from zero? So that's part of the information that needs to come out. But the point I want to make is that countries have made efforts fully vaccine all eligible persons in their countries, especially under the second wave. In Africa, we have Botswana. I think it has achieved it has procured full vaccination for all eligible.
We need to consider their population as well.
I know it is small, but also it is economically powerful. So it's not just population. It is also economically powerful and well governed. So it's not just one factor, because all these components matter.
Yes.
So, but how did they achieve that? They worked through the Africa Vaccine Acquisition Task Team. I don't know whether Uganda has contacted, because they were also faced with the same scarcity challenges. But through the Africa Vaccine Acquisition Task Team, they were able to procure doses of Johnson & Johnson and Moderna on top of AstraZeneca. And they have full vaccination for everybody, and they are preparing to regain their normal lives after full vaccination of adults. So we need to know what particular efforts are we making to ensure that there is vaccination available for all adults in this country. Or at least if you compare with so many, the rest of the countries, the minimum target is 60%, 60 to 70%. So where are we in this planning of massive vaccination? But also to the people who are listening to the program, I think people need to abandon the conspiracy theories that led to low vaccination turn up at the beginning of rollout of vaccination. And then embarrassingly, people are beginning to steal the vaccines that have been available, and nobody coming up to take them. So at times you wonder what kind of people are we, and you know the thinking. The medical personnel have been waiting for citizens to take up vaccination. Nobody was showing up, but now we have reached that desperate of stealing and cheating people through vaccination that were freely available for whoever was eligible. Yes?
There's another problem there. You see, where I come from, for example, we also have, of course, ignorance and cultural problems. In Busoga generally, you find, people are more concerned about, they are saying it reduces fertility, and you find a woman with 5 children, and she's busy saying, getting worried about being infertile. A man with 15 children and said, I will not take this vaccine because I somehow... so it's real, this culture and ignorance issues.
Yeah, it's true, but I think they should be part of the communication strategies. Should be
from the Ministry of Health.
Some of these conspiracy theories and our culture fears. So the second strategic approach would be to expand testing facilities. Because right now the cost of testing is so high.
Averagely, it's 100,000. Averagely.
That's the very minimum.
Yes.
I think averagely you should put it like at 180. That's the very minimum.
Yes.
So how many people can afford that? That also has increased the opportunities of self-medication. People are scared of testing costs. They don't have money. People are scared of treatment costs. I think ICU ranges from 32 to 54 million. So how many Ugandans can afford that? Under the effects on our economy coming out of the first phase. So I think government needs to take a particular effort on increasing testing opportunities for the people, and that will reduce the dangerous self-medication. Then also try to avail increased capacities for medical care. I know the hospitals are full. I have colleagues from the office who had the patient over the weekend. I think they found a bed after being bounced in 5 hospitals. So we have even reached a level where we need now to look at the home care-based treatment. This country has been talking of village health teams. Personally, I've never seen them. I don't know whether they exist. So if we have village health teams,
the VHTs.
Yes, if we have parish health teams, if we have sub-county health teams, can we reactivate them? Honorable Minister, I know you have left the Minister of Health, gone to primary education, but you are still part of cabinet.
No, let the Honorable Minister note that down.
Yes,
give her a
she will give us a response. So can we reactivate these health teams that go up to the village, supervise and monitor the home health care treatment for COVID that we cannot now avoid because we do not have the necessary health infrastructure to absorb all the patients for COVID.
Okay, thank you so much, Sarah. Honorable Minister, please note this as well. Back in time, that is early last year and probably late last year or even early this year, there was talk of as long as someone has symptoms for COVID-19, they get a free test for COVID-19. Is that still in existence? Because apparently whoever is having a cough, a flu or anything has to pay that amount close to what Sarah has mentioned to get their test done on them. Please note it down. I'll be getting back to you. But first, let's find out from the economic brains, that is Professor Ramadan Gobi. Many that are talking about the situation as is are kind of pushing for something, but that something they are pushing for, not so clear. They are shedding a picture, but the picture they shed is actually not clear. It's like a half shillot in the language of fine art. Honorable Katuntu made mention of something and said the president has delayed, he should come back, and he actually toned down and said, not to lock down, but... So, people are actually pointing at that as a solution, and I'm wondering, the way the situation of the economy got paralyzed the previous time, can the economy survive this time round? And more so, looking at the budget, 44.7 trillion shillings, which is partially going to be financed by we the taxpayers to a tune of about 22.4 trillion shillings. Is this money going to be realistically achieved whilst in the situation we are with a crumbled economy, courtesy of COVID-19, not even COVID-19, but COVID-19?
Thank you, Kent. You know you have exotic names. Tony, Kent. And now you're speaking exotic. Here's the UK strain of names. Now, number one, this pandemic gave us time to prepare ourselves, unlike other countries. Because we watched all of us TV when people were dying around the world, and the president became our regular visitor in our sitting room.
Some people dubbed the president a presenter.
To tell us...
Sarcastically.
Yes, to tell us the magnitude of the problem we were likely to face if we did not avoid this disease by just adhering to the SOPs. He emphasized that the best way to manage this pandemic is to avoid it. Is to ensure that we social distance and we practice all those things which all of us will know. So that we don't question, we don't, you know, there are so many words used. We didn't do that as a country. We tend to wait until we have seen evidence. And this evidence came last month. And I want to tell you, it is a terrible situation, as Honorable Katut has said. I think everybody here is now having someone they know closely who has died or who's in ICU or who are home, you know. And it's no longer anything which requires anyone to tell. So I don't know why in Uganda we listen more to quacks. I actually tweeted about it. We're a country that loves to listen to quack doctors, quack professionals, prophets, and so on. We want so much conspiracy theories.
When you say in Uganda, do you mean generally the populace or the leadership, or perhaps
generally
the ones that are
the
left?
people of Uganda, from there up to there, we have this weakness.
From up to down, like Mabirizi did mention one
conspiracy theories, gossip, you know, fake news vendors. We listen to them a lot, but people don't want to listen to professionals, don't want to listen to science, don't want to listen to facts. Up to now, there are people I see, some are very educated, but they are still vending misinformation. And these are the people who put this country in trouble. Because everybody was saying, look at Tanzania. Huh? They are in the stadium. Look at this. Look. And it became a joke for anyone to follow the SOPs. Some of us actually, I remember just a few weeks ago, I went to the village. My village is in Butambala, and my mother told me, take me to a burial. There's a burial. So I drove her to a burial. And I said, Mom, is it a burial for... He said, it is a family burial. And when we reached there, there were over 5,000 people. And we were only 3 people with a mask.
How did you manage to count out of 5,000, Mr. Ramadan?
Because you could see clearly.
That was sharp.
Yeah, you could see that we are
probably
1, 2, 3.
The masks had bright colors.
And people were all over the place running over food and after food.
Yeah, but of course we get your kind of analogy.
And the question all over that. So, we are a very serious population. And I think sometimes God sits there. You know, we are a very religious country.
Yeah, true.
Uganda, we are number 3 in the world amongst the people who believe that God is there and is the one who solves all problems. We are number 3 after Ethiopia and Senegal.
No wonder we are all African countries.
But now, these religious people, we are also very, very controversial. We don't want even to listen to God. So sometimes God, I think, says, these people are not serious, let me first test them. And this test is terrible. Death is with us. I have a feeling that, not actually a feeling, the study has come out now, that the reported numbers of both those who are getting infected and those who are dying are far much lower than the projected numbers. For example, since September last year, they have indicated we have been underreporting the infections and
the
death.
Yes.
Recently, we reported a peak of about 1,500 as the
But I think the Ministry of Health came through this week, Monday or probably late last week, to explain why there was a lapse and how they were trying to follow up on such to give a comprehensive figure.
Yeah, of course they can't, because you can't test everybody. But the projected number is over 9,000 now, that every day we get 9,000 new cases.
Yeah, sure.
Yes, Dr. Kamara.
In hospital, when you are talking about hospital-based care, in medicine we call it the tip of the iceberg. Actually, whenever you diagnose one person, like for us in the diabetes world, there are 5 people yet undiagnosed, but they are in the community. So Ramadan is very right to say that whoever presents in the hospital just is a representative, is just a picture,
sample,
a sample of what is taking place. If you get 1,000 people in hospital testing positive in Uganda now, I think it would be a very good estimate to say that every day we have around 5,000 to 9,000 people, because there is no testing in the, for everyone who has symptoms. At the same time, not everyone who is in the village is coming to hospital for one reason or another, for community reasons, because of transport, because of community factors, because of transport, for individual factors, because of somebody thinks that they have been bewitched.
So basically, chances are, even that person that is not reporting to probably get a test done could be sick where they are.
Sick,
but let me get back to Ramadan, as probably we conclude this first hour.
I wanted to come to your economics.
Yes, in addition to that, I have my supermarket, Ramadan, and people are no longer coming because probably they are not having the money to come and give me for the service they need from my supermarket, or perhaps they are sick or maybe locked out, courtesy of the eventual, bits of district, inter-district movements and the like. Stay home if you're not having anything. So, economic-wise, in probably 2-3 minutes, how does this affect us? How shall we come out?
I was shocked yesterday. I met a number of people when I went out for the first time from my home. I went to this Bugolobi. And I met a number of people who were actually asking for lockdown. People now voluntarily saying, why doesn't the president really come and lock us down? Because we're in trouble.
They lock themselves. A lot of people are working from home.
Yes. No, they were like saying, this, even if I lock myself home, when everybody else is moving, because we might not coordinate, is moving the virus around. Why don't you lock us? The point is,
it looks to be a tricky situation.
By the time people say, let us be locked down, it means that the situation out there is worse than we thought.
But probably before we actually take a break, Ramadan, just imagining that scenario of your people who have that kind of approach, maybe let's get locked down. If it happened probably this weekend, would it be a realistic entity? Locked down.
I'm not a scientist. The scientists are here, but me on the side of the economics.
Yes, in the angle of economics. I've not bought food. You've not cleared your goods. You are planning to bring some goods. Everyone is locked where they are.
The thing is, this scenario was modeled by economists. In economics, we use models to look in the future as if we are God. We saw and said that if we have one lockdown, which we had last year, the economy might shrink by 7 percentage points, the GDP. If we get a second lockdown, it might shrink by 10 percentage points. But now the people who are in charge of the economy, I think, ignored that and went for looking at a second lockdown as just a risk. You get it? That there is a risk of a second wave. So they didn't factor it into the plans. That's why you have a budget which is almost looking at a normal trajectory of the economy recovering.
Yes.
Let us support the recovery of the economy.
To a tune of
They
over,
never anticipated.
over
And
11
yet,
trillion.
we warned them as economists that there is a likelihood of a second wave and perhaps other waves because this is not yet concluded. They are, at least in terms of the knowledge. Therefore, the budget which was done, if I were in charge or advising the head of state and cabinet, it needs to be reviewed and cater for a possibility of getting a good chunk of this money to protect Ugandans from death.
Healthcare.
From death by taking them for a couple of weeks home, take care of them, and at the same time ensure that all Ugandans get, those who need a first aid test, they get it. Those who need a vaccine get it. And those who need treatment get it.
Is there a vaccine?
It's going to be so hard.
Because vaccines,
You can't.
I know that we are struggling to get them, but you shall get. I'm very optimistic that we are going to get the vaccine.
On the issue of vaccine.
Okay. Just come in briefly, Honorable Minister.
Yes, the vaccine, indeed, it is true. I'll probably bring a little bit science of it, but she had mentioned, for us to slow down this virus, or for us to say that, yes, we are getting the coronavirus out of the environment, the ultimate magic bullet is the vaccine. That means a big proportion of the community should be vaccinated. They should develop population immunity, or what is called herd immunity, so that they can offer indirect protection to others who are not having that immunity. Meaning that 60 to 70 of the percentage of the population, as you said, should develop immunity. So how do they develop the immunity? Two options. One is through vaccination, which is the safe, effective, and proven method. The second option, which WHO does not recommend, is subjecting the population to the infection with the hope that you recover and build immunity. How sure are you that they will recover? Chances that they will die is very high, and WHO does not recommend. Then, of course, in the absence of vaccination is where we have to do everything possible, the SOPs, to try to get immunities and other balanced diet, which we shall talk about it. But now, this vaccination, indeed we have received the vaccine, the initial vaccine, the 964,000. And today we are blessed, we got another 175,200 doses. Now, how sure are we that we can get another vaccine? For us to get another vaccine, it will depend on a number of factors. First of all, the rate of consumption, the uptake of the vaccine, because this is world globally problem. And each discovered facility, they are monitoring the response of each member state. How is our people responding, the uptake? Number two, accountability. Because it's not just you give the vaccine, we must account for each and every vaccine.
Honorable, are we getting the vaccine as a donation entirely, or we are buying? Because this batch of today is a donation.
The first was the notion,
Yes.
but already also government of Uganda.
Why I'm
We have already
Yes.
as government.
Yes, Honorable, why I'm asking you this is because the mention of they are monitoring, and so if we are not consuming, they can't give us. I mean, we have our money.
But
we
of
want
course,
to buy our vaccines
of
by
course,
ourselves.
Even our
as a
own
country.
scientists, we are monitoring, because this being a new virus, the vaccines have all come in place. The advanced effect of the
buying as a
vaccine,
country.
it has to be monitored. Even our own scientists that have been put in place, including WHO Vaccine Advisory Committee. We also have our Vaccine Advisory Committee that monitors the advanced effect. But also, the issue of accountability, first of all, the uptake, the accountability, and our commitment. How committed are we? Because even if let's say Serum Institute of India is now able to send more vaccines to us in the event that people are not taking up the first consignment, do you think they can give easily to us? So the point I'm bringing up is that the uptake really is very important. I'm happy that at the beginning it was not easy to convince our people, but now everybody is rushing to this vaccine. Unfortunately, some people are taking advantage of their desperation. But the fact that people are now embracing this vaccine, number two, we are really seeing that people are now eager to get more vaccine. That shows that, yes, government has to commit more resources so that we get more vaccine. But the aspect of subjecting maybe the budget to equip the hospitals or to ensure that we have enough oxygen, ICU, which is fine. But we must use public health approach in managing this pandemic. Because even if you put the whole of Nambole, even if you take a whole district and you convert to hospital, you convert to ICU, and you convert to the oxygen plant, you will never achieve your targets. But nevertheless, does not mean that we should not focus on the hospital beds and what have you. The point I'm driving is that our approach should be a public health approach, because this is a pandemic that we need our people to do more of what my colleagues have been talking about, even if it means to keep the body active, physically fit, if it means to get other means of boosting our immunity as we wait for the vaccine. That is what we should be educating our people. And really, that is what I wanted to interject on the aspect of the vaccine, but probably the other areas.
Yeah, but fortunately, at this particular juncture, I'm not as well going to get back to Ramadan, except for the fact that I will request my panelists, my guests, to probably take their water, to enjoy their coffee, as of course we prepare for a break. It's the 48th edition of UBC Behind the Headlines, and we are looking at COVID-19 in general, how the spike of infections has actually come our way, the capacity of the health sector, that is the medical fraternity, and as well the whole aspect of how we can come out of this without so much damage coming our way. Remember, for you that wishes to follow us, get down to Facebook, that is UBC TV on Facebook, and as well get to YouTube. This show is streaming live on YouTube, that UBC Television Uganda. Otherwise, on Twitter, the people that you see at this particular platform all have Twitter handles. You will definitely see them therein as you follow the hashtag, which is UBC Behind the Headlines. We return after this break for more on this COVID talk.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go. MTN.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines, and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from ASCEND Project.
What does it mean to be closer together? It's taking the last bus home for a surprise visit. Closer together is strangers finding a connection. It's bringing home something much more than a box. It's the warmth of home, or the beginning of something new. There's magic in sharing the things that we love, because it's those things that bring us close together.
Echa COVID-19 chijja kugwa. If we get vaccinated now, observe social distancing, wear masks properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
Welcome back from the break. My name is Kent, and this is UBC Behind the Headlines. It's edition 48, and this time around, it's a whole bit of talk on COVID-19. Many out there simply refer to it as Coffin-19, simply because it's indeed claiming lives. Very unfortunate. May the souls of those that have lost their lives rest in peace. And as well, for those that are still battling, we pray together that they will come out on top, victorious against COVID-19. Meanwhile, news coming in right now indicates that the third COVID-19 vaccine consignment was received by the Ministry of Health, and this was at Entebbe International Airport. Now, this is an addition of 175,200 doses of the AstraZeneca, this becoming the third batch, I'm told, actually, and this is actually picked from the Twitter handle of the Ministry of Health. The pictures you see on the side of your screen indicate that particular plane that had the consignment on it as it came through, and that is definitely good news for us Ugandans that are hoping to take on the vaccination. Now, why we invited doctors on the show is specifically to avail to us the expertise in line with what they have for us, because at this stage, Kent ceases to matter. So to some extent, Honorable Katuntu ceases to matter, but of course it matters. But definitely the doctor's word comes out on top. The president has often highlighted that the scientists and what they say is so core in as far as what exactly there is in the fight against COVID-19. Now, Dr. Moriku, probably I want you to summarize in 5 minutes the aspect of testing. We did talk about it, and Sarah was also highlighting something to you that needed to be given a bit of a highlight, more so to the public. And then in the process, in the break, during the break, while His Honorable Katuntu was sharing with you, I recalled something. That bottle, probably in the medical language, it's given a different name, the bottle that carries the vaccine. How many people are vaccinated per bottle? Is it one bottle per person? Because when we hear, for example, we've received 172,000 doses, are they going to work on 172,000 Ugandans? Or perhaps that means if maybe a bottle is going to serve 10 people, we do multiply by 10 and see how many it actually serves. So such clarities we need, and the floor is yours right now.
Yeah, thank you so much. Thank you so much. And I'm going to comment, yes, about the bottle and also the testing facility. But before that, allow me make this very clear to the people of Uganda. And I wish really, I wish also my colleagues could agree with me that the main major problem right now we are facing as a country. And the reason why probably we are getting overwhelmed with the cases in the hospital is fear, stigma, discrimination, uncertainty. We do not know what exactly tomorrow will be like. This is the time that as Ugandans, we should demonstrate some level of calmness. Because it is a battle. And when you are going to the battlefield and you go with the panic, you go with the fear, uncertainty. Certainly at the beginning of this pandemic last year, there was a lot of uncertainty. But by now, we should be calm. We face the disease with a lot of calm and a lot of hope. I bring this because my colleague talked about the community, which I will also bring the aspect of VHTs and home care strategy. When we get the people who are sick, they are asymptomatic, without symptoms, not yet probably to be taken to hospital for care, for oxygen, but because they are to be looked after at home, that fear, that stigma, that little support, really psychologically, you get a lot of torture. And at the end of it, you deteriorate very fast. My colleague brother here, doctor, can agree with me, and all of you, psychosocial therapy is one of the therapies that can stabilize a patient, even without strong, medication. But once your mind subject that you will get well, you will go through this battle, and you get better. Indeed, that will help you. So I want to call the people of Uganda, let's be calm and face this with lots of hope. But once we give hope, once we stigmatize the people with the COVID and isolate them and probably start pointing fingers, then that's when we lose the battle.
I can promise you, Honorable Minister, together with the team at UBC, we are going to work upon that and make sure every presenter that comes on TV, goes on radio, preaches the message of anti-stigmatization of COVID-19. So now let's go to
the point of testing.
Yes.
The testing, recall, at the beginning of this pandemic, we only had Uganda Research Viral Institute, UVRI, in Entebbe. Every test from Arua, from Tororo, from Kabale, from everywhere heads to Entebbe. And that was the time we started. And we test using PCR, meaning that we test the virus itself. But with time, we started accrediting quite a number of laboratories. As of now, we have over 15 labs that we accredited and are able to test. We got the lab, which are mobile lab, like in Tororo, like at the border posts that are able to test. And the whole of last year, there has been a lot of rapid test validation because it must meet the standard. Like our lab in Entebbe is one of the internationally recognized standard, even in the region. So this accreditation, the validation, according to WHO standard, there has been tests that they could bring reagents once validated, does not mean the standard. So it has been going all through until finally we now have the rapid test in place.
So it is the rapid testing that people are paying for? And
no, the rapid test people are not paying for.
So which
the rapid
tests are
test
being
is
paid
like
for?
the doctor is talking about, which was in the hospital. When you have symptoms, just like malaria test, when you have symptoms, you go and test, then that is when it becomes really helping you. But if you do not have symptoms, then you need to go and test the other one, which is PCR. Although it works hand in hand, after the rapid test, we are supposed to be subjected still to the what we call the PCR.
So of the two, because doctor, we are speaking in a language that probably confuses the layman out there, probably the victim of COVID-19. Of the two, the PCR that you're subjected to after the rapid test, which does a person pay for?
The test that we pay for is the PCR, and not everybody pay for. For example, if you want to travel, if maybe you want to know your status, you cannot line. You cannot go to the hospital. You prefer to go to the private lab. That is the categories of people who pay for the test. But for us, if I go to a regional referral hospital, like in Ikabale Referral Hospital, I test with the rapid test, that is the antibody
Honorable,
test without
I will
pay.
report to you, I've been talking about COVID from man to death on radio, Magic 100 FM. People have been calling from around the country, saying that in the referral hospitals that we have, they are made to test, rather to pay for tests for COVID-19.
Then that's a good information. Probably we need to take it up seriously and to find it out why people are paying for it. Because as far as I know, the rapid tests are not supposed to be paid for. But thank you for that information. I've taken it up, and I will tell to my colleagues, especially the permanent secretary, the director general, and give that feedback to them.
So going
Finally,
to the home care facilities, because I want to guide your responses, because I want the rest of us to have ample time. You're the key speaker in this, though. The home care facilities,
yes,
how do we plan to achieve this?
The home care facility, the moment we reach the stage 4 WHO classification, where there was extensive community transmission, that was the time when we cannot do much with the quarantine. We cannot do a lot with this isolating, following the contact. It wasn't possible because the infection was all over the community. So that was the time we brought, according to, there was a policy shift. The management of the cases had to shift to the community.
Yes.
A strategy was put in place, and then the Prime Minister, then who was now probably the outgone Prime Minister, Dr. Ruhakana Rugunda, launched that strategy. I personally has been involved in the rollout of that strategy. This is a strategy when we involve the community at village level. The leadership, the LC1, the older leaders in the community, such that the VHTs that we talk about and the other leaders, they take full responsibility. And this is where we reached to a time we said we need our community to take full ownership, to take complete leadership, to take accountability, and to be responsible for the health of their people within the community. And the VHT is the lead in such a way. He has the book, registry book. He records the number of people in the village, probably the ones who are sick, the ones who are not sick, the contacts and what have you. And this links to the sub-county, to the district.
In simple terms, it's community policing, but in a medical approach.
Absolutely. But of course, I must agree that there is a breakdown of probably the link, because there is the district task force, which is chaired by the resident district commissioner. And we have the team in the district, which team in the district is supposed to supervise and to ensure the village health team and the sub-county is very active and functional. Without that, it is very difficult to achieve the home care.
On behalf of Ugandans watching, that your ministry, Madam Moriku, does the needful, going down and getting back to the basics, showing whoever is in charge of what to do what they're supposed to do, so as to have that chain of command get down to the persons.
And that's why we are now trying to reactivate the district task force for COVID-19, so that they get back to where they started. At the beginning, they were very active.
Doctor,
along the way, they were active. It's only, as I said, when everybody went to sleep, because people thought the virus had gone away, yet the virus was in circulation.
Doctor, in the same manner of sleep, could it be government is asleep? I mean, Ramadan has a hospital, he's charging 5 million to treat us. Abdul Katuntu has one, he's charging 10 million per day to treat us. Sarah has one, she's charging 20 million. And then Dr. Kamara as well has a hospital, and it's up to him to charge less so as to take the clients that the rest of us are not taking. Where is government in this, as the charges for COVID-19 treatment are varying, yet at the same time pinching the public?
Well, this is a serious issue that really need to be a little bit regulated, streamlined, such that there is a fair pricing along the private sectors, the private medical practitioner. It's a little bit very difficult.
The lowest so far
it's
is
difficult in such a way that
day.
you cannot put a uniform charge in these private health facilities. And ideally, medical council, the regulatory body, the authority that is supposed to regulate the practitioners, supposed to come into play and to ensure that there is a fair charging of Ugandans. I recall once upon a time, they really tried, they attempt to trying to uniform fairly the pricing in the different health sector, in the hospitals, private hospitals. But it wasn't easy. Nevertheless, I must say that this is something that we need to take it up. The different stakeholders should sit down because it's really very unrealistic. Much as I know, ICU is not an easy place, but charging a patient between 1 to 2 million per day,
What is
maybe
the charge,
up to 5.
What is the charge in the referral hospitals? Because one might think perhaps this it only applies in the private hospitals.
Referral hospitals, we do not charge. We do not charge absolutely. Mulago private, yes. Of course, in the referral hospitals, there are private wings. But in the general treatment and in ICUs, in all the referral hospitals, we do not charge patients.
Okay. Doctor, I'll have to leave you at that. Thank you so much. You could as well enjoy your water during that particular time of excuse. Sarah, people are thinking a lockdown is a probable aspect to take on. I've been going through some of the hashtag responses, that is UBC behind the headlines, and there's many that are saying a lockdown will help us. Do you see a lockdown as a solution to this situation?
Well, in the last measures issued by the president, he did ask those who do not need to move and who can work from home to work from home. He also asked all employees to scale down staff and operate at 30% capacity. So I think really people who think they are safe at home, nothing stops them from working from home. Given the rate of spread in our community, and a lot of people that are doing home care treatment for COVID, my worry is drawing from experiences of the first lockdown, abuse of human rights, people who failed to access health care because of the mishandling and conduct of security. If you lock down with massive community spread, I work in civil society. I can assure you that almost every office has a COVID case. Yes, I am telling you. So if you lock down these people,
every office of civil society,
I am saying the ones I know everybody has a COVID case. They are at home, they are accessing treatment, they are recovering, but there is COVID. So if I'm looking at a sector and I'm telling you this, we've been told on TV that members of parliament cannot attend session because they were positive. So there is COVID in every sector. It is not just civil society. So if this is the situation we are faced with, if you stop people from moving, how are they going to access health care? Will the conduct of security change?
They'll go to
from the abuses and excesses we saw in the first lockdown, even where some pregnant women were beaten going to hospital. So to me, I think really with the level of spread, if you put a lockdown, we are going to lose people who could have saved their lives.
Dr. Kamara, I am this kind of person that so much works with the people on the floor, that is on the ground. There is so much happening. Someone amongst us made mention of social media and quick, messages, quick people and the likes. Yesterday, a message made rounds on social media, a purported doctor, not mentioning his name and saying there is a directive that doctors should actually let people die. That is the command. Verify, please. As a doctor, have you heard about this? Is it actually true in the profession that you people actually attach yourselves to? Do you succumb to such requests?
No. Medical ethics will not allow us to for us, human life is key. We can forfeit everything, money, can forfeit anything, but for human life, medical ethics will not allow us to say.
Money.
Yes, we can forfeit money. We can say, but for us, what comes first is human life. So I think that is a fake news. It shouldn't. I don't think it is true.
Okay.
Yeah.
Let me first come to Honorable Katuntu before I can switch to Ramadan Gobi. Well, in this final hour, we are trying to speed up, but as well look at all those other entities surrounding the COVID pandemic. When His Excellency Yoweri Tibuhaburwa Kaguta Museveni was speaking at one of the recent speeches, he said, probably it was, I think, the most recent COVID-19 speech, he said that teachers had to get vaccinated and highlighted former presidential hopeful Kabuleta, Mr. Kabuleta, for having mentioned it's not right to push people into vaccinations because it's illegal. You as a legislator, the legalities of this whole bit, people are being told, don't come back to this workplace if you're not vaccinated. Count this job no more if you can't get vaccinated. People have their views concerning the virus, or rather the vaccine, and as well in a collection of views from world over, more so the AstraZeneca, which is coming from India, where people are actually dying. What is your view on that as a legislator?
First of all, this disease is contagious. And if I am a responsible employer like I am, I need to protect my staff, myself and my staff, and including my clients who come and interact with my staff for services. If Sarah is one of my employees and she deliberately refuses to go for vaccination, it will be very difficult for me to let her come and work with me as an employer. It is her right, but that right should be subject to our rights too, to defend ourselves. So it's not about this is my right, but it's also my right to be there such that I can infect you. You can't have both. You either say, okay, if it's my right, I don't want to be vaccinated, you go back home. Because you see, what message are you sending to the other staff? But most importantly, even other people who are coming to interact with your office. So whatever Mr. Kabuleta, I don't know what he had taken that day, but I think I think that is certainly not correct. It wasn't correct.
Okay.
You see, we have to protect ourselves. You have a right not to be vaccinated, but you have no right to infect us. And this is a highly infectious disease.
Yes.
That's number one. But to go back to Dr. Kabuch again, she's shifted ministries.
Yeah.
She's not in health now. She's gone to education. But we did appropriate money last year for purchase of the vaccine. A lot of money. One
so
for commitment.
And so far we've gotten donations.
For commitment, to have been, in total I think it came to around $10 or so million, and so it was a lot of money. For commitment, and also to pay some advance to the manufacturers and so on. Yet, what I'm hearing now is that the vaccines which we have actually been donations. So at some point, I think government will have to explain to the public what happened to the money which was appropriated by Parliament for purposes of purchase. And let me tell you, we are why I get worried. We are talking about vaccination.
Yes.
We first got 900,000 doses.
964,000.
Yes. Now we have another 176,000.
75,000.
In total, it's around 1.2 million. If we are to take 2 jabs per individual, that means we are talking about only 600,000 people. And yet we are telling everybody, please come for what? For vaccination. And I mean, it's just arithmetic, it's not even math.
Is that having a consideration of how many people are served per that bottle that I asked about?
You asked me this question.
Yes, let's have that clarification, then I might make my point.
Let me just respond to this question you asked me. That small bottle you see, it has got 10 mils inside. And there is a provision extra for allowance for wastages as you draw the vaccine from the syringe. And that's to say each bottle has 10, but there are 10 meals, so that means each person gets 1 meal. That's why
so it's 10 people
when
per bottle.
we do not want to start opening when there are not 10 people. At the beginning, we get 10 people together, then we open the bottle, then after recording all of you, after consenting, the 10 of us, then we open the bottle, each person, you draw 1 meal, we give, 1 meal, we give. All of us get the 10 bottle. At the end of it, there is always 1 meal remaining. After noticing that this is wastage, so in some places we move to getting 11 people at a go, so that we get all those 11 meals, and we get to everybody gets. We put the bottle away, wait for another people, cohort of another 10, 11, then we give. That is what is aimed at.
The point
I
is,
wanted Honorable Katuntu to get done with this point.
Yeah, because the point is, when we talk about a dose, we mean the one meal.
one
you
dose.
get it. So it's not about the bottle. So at the end of the day,
well, the bottle is going to bring in Ramadan
Kent,
because
you know, Kent, you know where I come from again in the village. When I'm looking for forts, I go to all sorts of places. There are people who drink their thing and they share the bottle. So
their thing.
Let us not walk that path. So at the end of the day, I think we still have a big deficit in terms of vaccine, because 600,000 people. What is our target? The first lot, when we talk about the frontline workers, health workers, teachers, senior citizens, those with underlying conditions, we are talking about 5 million?
5 million.
5 million. But even of the 5 million, looks like the vaccine we have can only cater for 12%. If you're the mathematician. 5 million and 600,000, maybe it's around 12% or so. So of those who were at that time, who were vulnerable. Now we've gone beyond the 5. Now we are talking about literally everybody. Because the target maybe is now almost 20 million. If you talk about the young people, even those without people young but without underlying conditions and so on, we are coming to 20 million or so. When will we have enough vaccine to go around?
Now that is
it's quite hard.
Honorable Katuntu, I'm going to probably request the Minister for Hours for Finance Ministry, that is Ramadan Gobi, to come in at this stage. Why I'm emphasizing so much on the bottle is because the figure has been an issue in the public eye. What do I mean by the figure? We are talking of, let's say, let's vaccinate 6 million people. Now, when Honorable Moriku was giving us the aspect of breakdown of the bottle, I got down to the first dosage, which was 964,000. When we said doses, do we mean the bottle or the doses?
No, the one.
No, gentlemen, why I'm bringing this in is this. If you have 175,000 doses coming today, is it for 175,000 people, or it's times 10, and thus to say it will serve 1.75 million people?
Just divide by 2.
A dose is the 1 meal. That's what they call a dose.
I think that one is very clear. A dose is a meal.
A dose
is what you get. Now,
so if you need 2 jabs, it means everybody will have 2 meals.
Wow.
Can I give these statistics?
So chances are we got 1,750 bottles.
Yes, that is
in
true.
Simple terms. This mathematics is very vital for Wananchi watching the show. So when you see me insisting on it, you don't know how many are happy to understand these things. Technicalities are often left on the TV, on the radio. But the Wananchi down there who wishes to understand bit by bit. And I think it's actually generating for us something.
Yes, I wanted to give you these statistics that initially the target priority is 4.8 million people.
That's 5
and
million.
this comprised of the priority group health workers, 150,000, teachers, 550,000, the security personnel, 250,000, then of course the elderly, altogether about 3.4 million, and those with underlying medical condition, 500,000. Now, apart from the 175,000 doses that we received today, I've earlier on told you that before the issue of the Indian, the wave that came in India, before that, government of Uganda had placed order for more AstraZeneca vaccine from Serum Institute of India. Unfortunately, the wave in India came so strong that we are not able to get. Nevertheless, again, government is going to secure the 300,000 doses. This is now the Chinese vaccine, the Sinovac, and then plus other vaccine, because we are not having only one type of vaccine. We have other options, including Johnson & Johnson, which you talked about.
Yes, the likes of Pfizer and others that are likely to come, and probably the prayers for the Ugandan team that is hopefully going to come up with a vaccine after stage.
Ours is also in pipeline.
Yes, which was reported.
It is
by
undergoing through the clinical trials.
530 billion Ramadan was allocated to the health sector. Rather for vaccines in particular, to the health sector, that is for COVID-19. Is it realistic, or perhaps was it enough to see to it that the whole populace, not just the eligible persons, are vaccinated economically?
There is always, you know, in economics is grounded on one major premise, that almost always, the needs are more than the resources.
Okay.
We wouldn't have economics if we had enough resources to meet all the needs of
basically
of people.
Economics comes in to help us economize.
Absolutely. So it's about now trade-offs. What do you trade off? Because now, as they were doing that budget, the Honorable has told you, they didn't know that this wave would be as ruthless, or that perhaps actually we would be having another wave here. Because at one point, as the president said, we had closed the hospitals. There was no case. They were looking for people to try on the medicine. There were no sick people. So I think that as far as the money is concerned, that's not the point. The point is, for me, I think the efficiency with which we execute our budgets. If finance has put money for buying vaccines, and they appropriate, and perhaps finance releases the money to Ministry of Health, it's up to the Ministry of Health to ensure that these vaccines are procured in the right time and delivered. If they are not, that can't be a problem of the finance ministry or the treasury. But as you said, I think there has been also two ways of approaching it. Looking for the vaccines elsewhere, which now I think there is a clear frustration that we are not getting them as we thought we would get them. We over-relied on India, and now they were hit by this wave, and they stopped selling it, and you can't blame them, because they had to first cater for their own people if they didn't have enough. I know the president was not happy with that.
Yeah, he made mention of that.
Yes, but I know that it would be exceedingly difficult. The way India, you know, was seeing the reports on CNN, losing thousands of people every night, actually running out of wood to burn them, and then you think of giving other people vaccines. It was a bit tricky for them. But now that our own vaccines are in advanced stages, and you know our scientists actually have been doing a fantastic job, silently.
True.
Our hope is that they get out this vaccine quickly. But also, my hope is that there is enough confidence and trust in the people of Uganda. And because if they don't, then others will take them because they will buy them. Everybody is looking for vaccine.
For survival.
But without I think, playing the vaccine ticket, I really feel that the survival mode now for the population is how do we avoid this virus if you haven't got it yet. So I would want these scientists to tell us whether really social distancing is effective when the virus is at household level. Almost every household does a virus, the way I see. Because now children went back home from school, they went sneezing. Of course, for them, the immunity levels are high, so they could just sneeze and go. But now they took it to their parents. Where they are now, they are loitering around the villages, playing with each other, still multiplying the thing.
Visiting grandmothers.
So, yes, visiting the grandmothers. On my Facebook and Twitter now, every time I open, there is a grandmother who has died, or grandfather, or somebody's parent, or so on. Old people are dying, really. I know there are some young ones who are dying, but the old people are very, very much vulnerable. Every day I see, because me I teach, I think my sample space is mainly children. These younger people who have still their parents and grandparents, they are announcing death every day. So how is this going to be stopped? I also see a lot of queues now at pharmacies. People are queuing up for medicine. And he said that they are self-prescribing. But the people are there looking for medicine. How are we going to be helped in this? Then the cost of those who have gone to hospitals. Someone talked about it. But you see, this pandemic perhaps will help us going forward. Because some of us, we have been talking about these things. You know, there is this economy the president was talking about, the pathogenic economy. That now, since others have diseases, you can take advantage of it and make money. But now with this pandemic, should we leave the economics, the market economics, and the fettered market economics to really work the way it was working before? Because this is not news for some of us. Mothers in this country have been delivering babies as if they are buying them. 5 million shillings for a C-section in some of these hospitals in town. And you know, the way these hospitals confine people in tight corners to get money out of them. Some of us, we have been complaining about it over time. They remind me of Caesar. There was a man called Caesar in the old Roman Empire who owned a fire extinguishing company. And for him, his trick was he only bargains for the price as the fire is raging. You call him, my building has got fire. He comes and parks his vehicle there full of water and say, how much are you paying for me to put down the fire? Mr. Caesar, why don't you first put down the fire, then we bargain.
You bargain for what?
For stopping the fire.
That's not economics.
You get it? By the way, economics has a human face.
No.
That one is not. That one is the economics is not reasonable, which doesn't work actually. Because at the end of the day, you create a situation where man eats man, dog eats dog, and that economics has failed even in the grandparents of capitalism in the United States of America. They are also saying, let us revisit this. I look at now people. The other day I saw the Canon Nakalema was in the tax park fighting with the buses.
Monopoly.
Because now they had increased the price to about 10 times so that they can make some money before the lockdown. Now they are not working. They were saying, let us collect some money. But from these people you are collecting, from the students going back to their homes, and what do you think about that? What will happen?
What we think about them probably is what we should take as food for thought. But Dr. Kamara Nicholas, also an honorable member of parliament, Ramadan is asking a very big question. Is the aspect of social distancing still as helpful as was before? And then too, there was the big news, probably, was it on Monday, Tuesday? Yesterday, when one of the honorable designates then came through for vetting, and as we speak right now, it's now an honorable minister, donned in what is purported to be a 3.7 million Uganda shillings mask. Has that mask been okayed by the Ministry of Health and WHO? So probably maybe Abdu Katuntu could return with it the next time round?
Okay, thank you so much, Ken. About social distancing, really one of the reasons why I was, when the last lockdown was effected, I was in the village in Rukunjiri, leading a 300-bed hospital. As Sarah has said, what we saw, patients, actually we lost many patients who could not reach hospital, because to reach hospital you had to get a paper from the RDC. And actually, as if that was not enough, you had to get transport from the RDC. They were designated ambulances. I'm glad the government now has really put a human face on this lockdown, partial lockdown they have made. The second thing is about our housing. I am a politician and I move to people's houses. Some of these people, and I've been really saying the housing policy of government.
They also move to your house, by the way.
They also move to my house, yes. But the houses we have, what are the houses we have in the villages? Okay, maybe Abu Katuntu may have very good houses, but the situation in Uganda, it is a single house, maybe 2 rooms, not lit. A person goes there for only one thing in this house, to sleep. That is the use of the house. You know, when we say social distancing, then people be in your houses, you just have this idea of Ramadan, watching TV, in a sitting room, in a sofa. No, these people go to houses just to sleep. And as soon as it is morning, they run out because it is not conducive to be in the house.
There is no ventilation.
There is no ventilation. The house is dark. The children are crying. They slept down. People have to sweep. Maybe you are cooking in the same house. So when you say people, when you talk about people being in the house, you don't have an idea of the house you have here. So having said that, the transmission, in the house is high because you cannot be isolating somebody when you have 2 rooms. Where are you going to isolate them from? Are you going to put them in the kitchen?
Probably in the corner of the house.
Maybe if you are lucky, you're going to put them in the corner of the house. So much as we are talking about this lockdown, we must be realistic over the conditions we have on the ground.
Okay.
Social distancing
is still effective.
And it is effective.
Yes.
But realistically, at the village level, with our conditions, it may be hard to put in practice.
Okay.
Again, when you talk about this social distancing, again, I was in the village that time. What happened? The towns were closed. People went to the villages, and it was business as usual. I used to jog around the villages behind the hospital. I found all trading centers behind. Unless a policeman comes and chases them, it was business as usual. So that is what I see as social distancing in real terms, practical terms. About the mask, it was my first time to hear about it. Maybe,
but I'm happy.
The former Minister of Health has one at home.
I'm sure,
but I haven't heard about the LG mask.
I'm sure Honorable Nicholas Kamara, as probably Dr. Moriku comes through, your people are happy, the people watching you right now. Why I'm saying so, you've emphasized your village so many times on this particular show, and I'm sure if all goes by the way you're doing it, that representation might actually win you an extra handshake from your people to Parliament after 2026, God willing.
Thank you.
That is a campaign you should be paying for. Anyway, before we go to Dr. Moriku, because I think perhaps as I can look at the clock, time is running out eventually, and some of these people have had a very long day. They need to go rest and prepare for tomorrow. Dr. Moriku, if at all temperatures got back to the highs that they often are at, that is the high temperatures, is there a chance probably this seemingly tough wave could probably be normal? Because you highlighted somewhere that one of the factors is environmental, but then the high temperature destroying the virus. Surprisingly, if one has the virus, they record a high temperature. So I wonder which one is which.
Well, that one we cannot discuss at this point in time because that you may not understand, because once a germ enters your body has to react, and there's a lot of reaction, inflammatory reaction, because this germ goes to the lungs, it goes to your small airways that causes gases exchange. And then as a result of that destroying the cell lining, the endothelium lining, it causes leakage and a lot of process taking place within there. So that's why you get maybe leakage, then going to the other systemic part of the body, the kidney, the liver, and what have you. But leave alone that, there is already, you know, the regulatory centers in the brain and all that, that needs now medical juggle. But what I can say, once there is a foreign body, foreign in your body has to react. And in the process, the thermal center in the brain has to sense. And then, of course, the process of fever comes in. That is different from the temperature we talk about in terms of survival or the survival for the virus in the outside the body. But certainly, as we see the weather pattern getting...
Is there COVID-19 in Kalahari, in the Sahara Desert? Is it there, where the temperatures are extremely high?
Well, that is subject to study, and I think we need to, as scientists, we need to read more about that.
Honorable Minister, I need to listen to this. This is actually one of the comments coming in from one of the viewers. Thank you so very much for watching UBC TV, UBC Behind the Headlines. This person here says the country is overwhelmed, and as of 14th of June 2021, 2 days ago, we only had 950 cases on admission. What then becomes the scientific explanation for us to understand the figures? Many sick. On admission, they are less.
I think that is why we talked about the home care.
Actually,
because
you could be seeing what is on the screen to purport what I just talked about.
Yes, not everybody is to be admitted. We already talked about the presentation and the progression of this virus. It is only those that are severe and critical are the ones to be admitted. The ones that are mild, asymptomatic, are to be managed at home. That is why I said by WHO classification, once the virus has reached stage 4, you have to change policy. Initially, you manage everything in a health facility, but now the asymptomatic, you shift to manage at home. That probably explains that not everybody is in the hospital. Nevertheless, as we said, there are people who may not have been tested, they have been treated, and they recover without even the statistics capturing them. So we have very many in the community that are being managed, and if they are not getting better, then they come to the hospital.
I would wish to stick to the midnight hour as the final bit of our input and appearance on TV. Probably because the rest of us are common figures, from Ramadan to Abdu Katuntu, maybe save for Dr. Kamara and Dr. Joyce Moriku, who have given us a bit of expounded approach to most of the things. I will beg Sarah to give us conclusive remarks and more so a special message to Wananchi watching us in as far as COVID-19 and how best they should keep themselves safe going forward.
Well, I think as a country we can get out of the second wave and even prevent against the third and fourth wave that is happening elsewhere by doing three things. One is following the standard operating procedures to the detail. Wash your hands, sanitize, social distance, and wear your mask whenever you are in public or with crowds. The second measure is immunization. That call goes to the leadership of this country. We need to focus on ensuring that we have 60 to 70% adults immunized in this country. The third issue is testing and healthcare capacities. This is the duty of government. Government should not abandon their duty using an excuse of private operators. They should make sure there are provisions for testing to those who need to test, and there is capacity to treat those that need treatment for COVID for us to get out of this pandemic. Maybe the last point is, as we save lives, we should also save livelihoods, because at some point it does not make sense.
Even poverty kills.
Yes, poverty kills, stress, frustration. So that should also be a consideration and occupation of the leadership of this country to address.
Well, my producer has just shared with me a message via one of these communication gadgets and says, Honorable Abdu Katuntu should tell us what exactly we should expect in as far as the fight this time round. Can we overcome it in probably less than 2 minutes?
It's difficult to say. Of course, we have to be optimistic. We cannot afford to give up. But it's going to be a very hard fight that we must really prepare ourselves for. One, we need to appropriate more resources. And I also appeal to the bad-mannered guys who always put their ugly hands in the public till, that this time really they should do, they should behave. Because let me tell you one thing, Kent. There are many bad-mannered chaps. When we have a crisis like this, it's time for them to harvest. Because they know there is too much resources and we are scared, and getting money for those purposes, we are not even going through the normal procedures where we have checks and balances here, procurement, safeguards, because they are, some of them even blackmail. So no, we need this money because we need this and so on. And in the process, they do what they always do best. So I hope this time our institutions that look to that direction where they have to protect our resources, they should. But it also goes to what the president said, that you can at an individual level avoid this disease by discipline. Following the SOPs, really you can to some degree avoid this disease, and I think that's what we should be looking for.
Thank you so very much, Honorable Katuntu. It would be bad manners, by the way, for me not to thank him, as well as the rest of us here on this platform, starting with Honorable Joyce Moriku. Very tight schedule she had, but made it to this point. Thank you so very much. Sarah Birete, it's a pleasure meeting you in person on this particular platform. I've always been watching you on TV with Charles, and well, Charles is on leave, partial leave. Dr. Kamara, also a member of parliament. Hopefully I could host you on one of our shows, Magic 100 FM. Feel free to come through. Honorable Abdu Katuntu is a bit scarce. Probably I'll talk to Oscar Semwe Amsoke to avail him to me. But as well to you, Ramadan Gobi, thank you so very much for availing yourself every now and then when needed on the show. Honorable Margaret Muhanga wasn't feeling fine, so she decided to opt out, as well as opting out of Zoom. But we do thank you, the listeners who have been following on the various radio platforms, but as well you, the viewer, that has been a part of us from the start to this particular time. Otherwise, to the technical team, the engineering team, management, as well as the welfare team, we thank you so much for making it possible for us to have this interesting debate come its way, as well as have an interesting session telling the public what they need to do concerning keeping themselves safe from COVID-19. It's been the 48th edition of UBC Behind the Headlines. My name is Kent. Good night and good morning.